Good afternoon to all my faithful listeners. This is Doc Dave again, and today we have episode number 39, and this is going to be on stem cell transplants. Now, I know that's something everybody's read about or heard about. Very little understand what it really means. I had to actually do some research because this wasn't in my wheelhouse of medical knowledge. But what I did is kind of condensed it down to keep it, understandable. It's very confusing, very complex. So I'm going to just highlight a few things just so you can get a general knowledge and understanding of what stem cell transplant's all about. So first of all, it's a medical procedure that replaces damaged or diseased blood-forming cells with healthy ones. So if you got medical conditions, what we're going to go under now, that cause damage or disease to the blood cells, then this is how you can replace them with healthy cells. So first of all, it's used to treat the following disorders. Number one, blood cancers. This is the most common one, such as leukemias, lymphomas, any type of cancer that destroys blood cells, red blood cells or white blood cells, can be somewhat treated with stem cell transplants. And we'll explain what that means in a minute. The second one is bone marrow disorders. Now, the bone marrow is where the majority of the healthy blood cells are made. The spleen also and a few other organs, but probably 80% of them are made in the bone marrow, and they're released constantly. It's the big turnover of blood cells. They only last so long, and then they break down and get excreted, usually in the liver, and then into the urine and into the stool. That's why your stools are dark, by the way, or black or dark brown, because that's the breakdown of the red blood cells from the liver that causes the stools to become that color. So that's just a little interesting sidebar. So any kind of bone marrow disorders, such as aplastic anemia, for example, which is where you get fibrous infiltration into the bone marrow and it depletes the bone marrow's ability to make blood cells. So this stem cell will boost the blood cell production. Number three, immune system disorders, such as combined immunodeficiency, which is, just a real technical term for a deficient immune system. And when you have a deficient immune system, usually that means you have deficient white cells that fight off infections, and this is one way through stem cell transplants, how they can boost that production. Number four, genetic blood disorders, very common ones, sickle cell anemia. Sickle cell means that the cell looks like a sickle, the red cell, and therefore it gets trapped and broken down prematurely and doesn't carry enough oxygen around. And therefore, the unfortunate patient with this disorder gets extreme pain and discomfort in joints and muscles and stuff like that due to the lack of oxygen presentation to those organs. And stem cells can help this as well. And the last one, number five, advanced lumbar disc disease, which is interesting. There's a new technology out now. And it's somewhat unproven, but it has a track record it's developing, and it's for lumbar disc disease. And what it does for herniated discs, it is called a hypoxic myelogenous stem cells. So what they do is they take stem cells out of your bone marrow and introduce them into your herniated disc. And that helps them to heal and shrink down and stabilize and improve the herniated disc. Now, types of stem cell transplants. What kind of stem cells do we have? So you have three different types. You have autologous, which is a transplant of patient's own stem cells. They are collected from the bone marrow and then stored and transplanted back into the system. So these are from your own bone marrow. So, the cost on these is really pretty significant. So you got to make sure you have good insurance. These can be anywhere from $50,000 to $100,000 for autologous transplants. Now, the second one is allogenic. And this is donated stem cells, such as from siblings or family members that match, and even unrelated donors occasionally can match. So this is even more expensive. This could be anywhere from $150,000 to $500,000 for the process. So you got autologous from the own donor's bone marrow. You got allogenic from a matched sibling or family member as a rule. And then the last one is synergetic, which is stem cells donated from identical twins. So these are generally pretty easy to match, and that's the process where you get those stem cells from. Now, the procedure, how does this work? How do you get these stem cells out of and into the patient? So the procedure from them is, number one, collection of the stem cells. It's a bone marrow aspirate. They go in with a big needle and they aspirate healthy, productive cells from the bone marrow that will produce new, healthy blood cells. So it's that's pretty simplified. Sometimes they can take it from the peripheral blood as well, but usually those cells might be older and not as effective and not as long of a transplant life. So that's how the collection from the bone marrow, big aspiration. Number two, transplantation. And these are taken from people and are infused intravenously into the patient's bloodstream. So this just goes out of the bloodstream or out of the bone marrow into the bloodstream. Somewhat similar to the above collection, but a little bit different procedure. These are in conditions where you have chemo or radiation that kills off the diseased bone marrow cells, like if you have a leukemia or lymphoma, and then they try to collect healthy cells from the bloodstream. The last part is recovery. Now, once the patient gets their, let's say the most common one, bone marrow aspirate, and injected into their system, the recovery is quite laborious. It's a long procedure. It's not just an outpatient procedure where you get your bone marrow aspirate injection and go home. Patient is hospitalized generally for a couple of weeks, and this is due to the producing of the healthy blood cells that you're injecting from the bone marrow. It takes a while for those to become efficient and to become part of the blood cell circulating and fighting off infection type cells, red cells, white cells. So it takes a while for this, and you usually are hospitalized sometimes you're isolated, and you have to wait a period of time until they start producing healthy blood cells. Now, what are the benefits of stem cell transplants? Well, stem cell transplants can be life-saving treatment. We all know that. And, sometimes these people, unfortunately, they don't have other resources or other options. This is it. You either get a stem cell aspiration out of your bone marrow or somebody else's, and you just hope it takes and produces new healthy cells. So that's the benefit. Now, what are the risks of stem cell transplant? Well, number one is infection. You have to be isolated in the hospital, like I say, for about 3 weeks after the procedure, so you don't get exposed. It's a graft versus host disease, so it can be rejected depending on how well it matches. The donor immune system attacks the recipient body, so you got to be careful when you use donor recipients that they match as well as possible. So the other one is, infertility secondary to chronic chemo and radiation therapy doesn't really have much to do with stem cells, but it's part of the process that you're treating and fighting the leukemia and lymphoma. Other disorders, like bleeding, if the coagulation system is affected, or the development of tumors. So that's pretty much it in a nutshell. The survival rate 10 years after a successful stem cell transplant can be up to 80%. So in the long run, it's worth the time, effort, possible expense, and discomfort and isolation period afterwards. So that's stem cell transplants in a nutshell. I hope it was somewhat informative and educational. It's a very complex subject. I just tried to isolate it down so that it's more understandable. That's the whole process of these this podcast and these episodes, is to bring it to the layperson so that they understand medical terminology and medical procedures. So this is my process that I want to develop through all of these different episodes, so that it makes the average person more understanding of medical technology and medical procedures. So thank you for your time today, and go ahead and hit the like button. I always like that. Subscribe so you'll get notifications of my next upcoming episodes. And remember, again, I am your friend, not your doctor. So, obviously all these complicated procedures need to be coordinated and processed through your own physician for referrals and so forth. So have a good day, and thank you for your time.